rocking and rolling?
Mm-hmm.
Awesome. Thank you guys for allowing me to return to the Crisis Stabilization Unit here in Cedartown. Again, my name's John Baldus. I'm a mental health nurse at the Rome Crisis Stabilization Unit. Been there for a few years. Have a topic here, alternative approaches to the use of seclusion and restraints in an acute care behavioral health setting. Really hits home for me and for the staff that I get to work alongside and the individuals that we get to serve. So I hope it's informative and enjoyable and interesting. Let's get right into it. Defining seclusion or restraint. Seclusion, the involuntary solitary confinement of an individual. Restraint, any method, physical or mechanical device, or material or equipment that immobilizes or reduces an individual's ability to freely move his or her arms, legs, body, or head. Also, a drug or medication could be used to restrict behavior or freedom of movement. The risks of using seclusion and restraints. Physical risks of injury to both the patient and the staff. Studies show patients who experience seclusion and restraint remain in care longer and are more likely to be readmitted to care. Reasons for that come to mind when we're, seclusion and restraints are a last resort measure. When we are jumping to that measure, we are automatically taking a lot of the choice away from the individual that we're serving, thereby discouraging their participation in the treatment plan, in the aftercare plan. So the likelihood of them being readmitted / not following up as would be appropriate and optimal is going to be greatly reduced. The goal of this project is to reduce the use of seclusion and restraints in the acute care behavioral health setting. Why is this a problem? Well, it does not optimize patient outcomes and puts staff at a higher risk for injury. Objectives is to use evidence-based research to promote the reduction of the use of seclusion restraints and any physical or pharmacological restrictions to the individuals that we serve. It's to provide more education to employees on risk management strategies, to allow staff to feel more confident in their abilities to prevent behavioral emergencies, to provide more support in caring for patients. Patients should feel a higher level of trust in the healthcare team. Additional training should be provided to help provide early intervention to prevent possible dangerous situations from even occurring. Rationale for this project. The methods of seclusion and restraints are viewed as traumatic practices, and they're to be used only as a last resort when less restrictive measures have failed and the safety of the unit is at risk. This is to be implemented as a last resort, right? So why is it important that it be a last resort, and why is it important that less restrictive measures be used first? Because it provides the individuals we serve with more respect, dignity. It increases their own personal investment in the treatment itself, and promotes an improved, more compassionate culture for both patients and healthcare workers. According to the Substance Abuse and Mental Health Services Administration, research shows that programs that have reduced seclusion and restraints have seen many positive outcomes, including reduced staff injury, reduced staff turnover, higher staff satisfaction, shorter lengths of stay for patients, improved compliance with aftercare recommendations, and a significant cost savings to the institutions. All right, the PICO question. How do de-escalation strategies and staff training reduce injury risk for patients and staff and provide a more therapeutic outcome compared to using seclusion and restraints? All right, the following are 3 examples of research studies and evidence-based prevention methods that are being used to reduce the use of seclusion and restraints and bring about higher levels of safety and satisfaction for both staff and patients. In a study, the way patients are treated and the way they perceive they are treated are both of utmost importance, as they will not be able to receive the help they need to change and grow if they don't feel acknowledged and significant. Patients should feel they are the reason nurses are present to them. They're the reason that nurses came in the first place, to care for and to help facilitate optimal outcomes for them. In a 2014 study at an acute care mental health inpatient unit, staff training program on crisis intervention was implemented. So during the 4 months after they were finished with this training program, episodes of seclusion and restraint use were lowered by more than half, from 19 to 7, as compared to the previous 4 months, which was before the training was implemented. Studies have concluded that 4 big contributing factors were found to decrease the use of seclusion and restraints: leadership and support from management and nursing practices, greater degree of multidisciplinary team input, revamping the inpatient setting, changes in treatment-related components such as gathering behavioral history and improving documentation in patient files. Recommendation for the organization here at Highland Rivers. Trainings and policies are set up by Highland Rivers Corporate. They would be passed down to the individual units. Scheduled days would be provided for nurse managers to attend trainings. That would be a beneficial place to start with leadership. Trainings will focus on both the verbal and nonverbal strategies for de-escalation. For instance, effectively managing one's language patterns, tone of voice, as well as body posture, eye contact. Once a program is in place, this would become a part of every new employee hire training process. This will keep all employees educated, as well as help maintain low staff turnover, as well as employee satisfaction. Procedure. Nurse managers and staff who occupy a leadership position would go through the training first. They should be trained to become a coach for their very own staff members. Trained coaches are going to return to the work site whereby they serve and begin working individually with the nurses, HSTs, technicians, case managers, and ultimately all staff who may encounter any individual being served. We will hold regular, energetic, motivational meetings where we address any concerns that the staff may present and provide encouragement to one another. For example, allowing staff to voice concerns over this new training process, encouraging staff to provide active input into ways to improve the existing training program, and also to encourage staff to share the recovery-focused stories of success where the training has been effective. To continue, we will develop a new comprehensive behavioral response training for all new staff hires and a continuing education program for existing staff who have undergone the training. More on the procedure. Initial training with nurse management would occupy 4 8-hour days. Working with other staff should take 2 to 3 weeks. Implementation of new policies may take up to several months. Recovery-focused motivational meetings will provide healthcare team members the opportunity to contribute to and learn from fellow team members. These meetings will occur weekly. Each team member will be reinforced with a purpose for this change and the role they have an opportunity to play to effectively implement the intervention and promote an optimized experience for staff and the individuals they serve. Now we'll talk about some of the general steps to de-escalating a challenging individual, right? Number 1, very important, validate and acknowledge how an individual feels. Individuals have a right to feel angry. Listen to understand. Meet the individual where they are. Folks don't like to hear when they're angry, just stop being angry. Listen to understand. Listen to validate how they feel, and it's okay to feel angry. Listen to understand, establish rapport. Next, help an individual find options. After you've established rapport, help explore the consequences for each option. Help individuals see the bigger picture. Ultimately, allow for choice. I'm here with you, and I respect you. Goal is to provide a safe space to respect an individual's free will. Evaluation of project. Data will be gathered to compare the use of seclusion and restraints before and after changes of training are implemented. Data would also be collected on staff members involved in incidents to show if the staff members had been properly trained and evaluated at that time. Data would be collected on the number of patients returning to the unit within 30 days post-discharge. Quarterly staff evaluations would additionally include testing of the knowledge obtained from the behavioral response training, as well as measuring the overall satisfaction healthcare workers are experiencing with their work. Expected outcomes of the proposal. I expect positive outcomes to be reported from patients as well as staff members. Patient compliance with aftercare should increase with more staff training in de-escalating potential incidents, and thus creating a stronger bond, rapport, understanding between healthcare providers and the individuals being served. Staff will report increased levels of satisfaction in their ability to remain competent and confident in their delivery of patient-centered care. We're talking about trauma-informed care, recovery-focused care, where we're not just working with an individual to eliminate negative behavior, to eliminate negative thought patterns, but to provide a hopeful future. As we decrease the incidence, as we decrease measures taken to take away choice from individuals, we're going to increase their own investment in their treatment, therefore their own investment in their aftercare plan, and ultimately their own investment in their life. And as nurses, we can't forget, we get to be hope. We get to be light for individuals who've lost permission to have that for themselves. Conclusion. What an opportunity we have as nurses to help identify areas that can be improved, collect data supporting an alternative strategy, and ultimately to analyze the data to create an environment and care for the individuals we serve. Possessing knowledge of evidence-based research is such a strong component to providing quality, compassionate understanding and education to patients and their families. I believe implementing a de-escalation training program for all employees will lead to a renewed, recovery-focused dialogue between staff and the individuals we serve, and between staff members as we relate to one another. Thank you very much. I appreciate your time. It means a lot to me. Have a great evening.